Today we'll talk about Kynmobi. It's one of the new medicines that's out in 2020, one of the silver linings of the pandemic. So Kynmobi is an apomorphine, so it's a dopamine agonist. So it's in the same class of medicines as Mirapex or pramipexole, Requip or ropinirole, or Nupro or rotigotine. So it's a dopamine agonist, and it's apomorphine. So it's like the medicines if patients are taking Apokin, which is the injectable form of apomorphine. This is a form of apomorphine that's as a film that you put under your tongue, and it's absorbed in the oral mucosa, and then it's absorbed much more quickly than going through the stomach. If you swallow the Kynmobi film, it's game over. It's metabolized and it's not working. So it's very important to keep it under the tongue, not on top of the tongue, under the tongue for 3 minutes, and let it dissolve and absorb in the oral mucosa. If you have a dry mouth, which many PD patients do, you can take a little bit of a sip of medicine, a sip of water before you take the film, and that way it helps the absorption of the medicine. So one nice thing about it, so it's a rescue medicine. You can take it up to 5 times a day. So patients who wake up in the morning, it takes them a long time for that first dose of levodopa to kick in. You're waiting an hour for, it takes an hour to get dressed and bathe. Kynmobi is a nice option in those patients to kickstart your day and make it to that first dose of levodopa. So you put it under your tongue, and it starts working in about 15 minutes and can last up to an hour. And it bypasses the gut. So remember, again, the problem with gastroparesis and Parkinson's disease, again, we have bradykinesia, which means slowness of movement, and that involves all of the muscles of the body, including the muscles of the gut. And because your gut is moving slower, you swallow the pill. That, especially that first dose of levodopa in the morning, takes a long time to kick in because you haven't had any medicine throughout the night. So it sits there a little bit longer than it should, and it takes longer to be absorbed in the small intestine. So we use a rescue medicine, which we have several on the market now. Kynmobi is one of those. The other one is Ambrosia, which is an inhaled form of levodopa that goes from lungs to brain. Again, bypassing the gut, it kicks in a lot faster. So we take it under the tongue, it dissolves, it kicks in, lasts about an hour until your next dose of medicine of levodopa starts working. And again, you can take it throughout the day. So if you're taking your medicine and it always wears off on half an hour before the next dose, you can take Kynmobi during that time. Or if you're at your Rock City boxing or your physical therapy and in the middle you wear out, you have the medicine wears off, then you can use a rescue medicine at that time. So that's what it is. It's apomorphine, a dopamine agonist, so some same side effect profile as the dopamine agonist. The other extra side effect that you may notice is some irritation of the mouth, the tongue, the lips. If that happens, we would stop the medicine. But it, again, can lower the blood pressure. So we always want to monitor the blood pressure, especially when you're first starting the medicine. It can cause some nausea. So many patients will pre-treat with Tygan or a nausea medicine before you start the medicine. So and it can cause excessive daytime sleepiness, impulse control disorder, hallucination, but all of that can be mitigated by changing your dose of levodopa. So that's Kynmobi in a nutshell. So again, very important. It's a film that you put under the tongue, not above, and you don't swallow it. You keep it under the tongue for 3 minutes. If it takes a little bit longer to dissolve, take it with a little sip of water before that. If you swallow it, the drug is metabolized and it's not working.